First of all, I want to thank the organizer committee for the invitation. Today, I'd like to provide some indication from the point of view of the physiotherapist about what a nurse should take attention during the management of the patient in the post-shoulder surgery. Today, I'm not here to defend a surgery approach or a choice to immobilize nor for how long. This is a surgeon problem for me. Instead, I propose a moment of reflection through some tips I like to share with you. The two objectives of the post-surgery mobilization are to stabilize the operated articulation in a way to better manage the post-inflammatory pain and inflammation, and to protect the contraction of the operated tissue. So, immobilization doesn't mean no movement at all, but control movement. So I like to show some examples about the nursery cares and the rehab programs. I will not speak about the post-surgery of the rotator cuff repair and the instability. So, in the first case, the post-surgery proximal humerus fracture. After the surgery, we are used to immobilize our patient in the internal rotational sling with the forearm against the abdomen, or in a natural rotation orthosis for 2 weeks maximum. During your nursery case, you can ask to your patient to sustain his shoulder by an active contraction of his muscle. And you can move it in a passive way, in deflection, in abduction, even asking your patient to help you a little bit. But something you have to be really careful is in the rotation movement, in the external rotation, in a passive, in an active way, and in internal rotation, because we try to avoid the potential uncorrected rotatory malunion that can create a disturb in the position of the bicital groove, leading to accelerated the biceps tenosynovitis. For the rehab protocols, we indicate to the patient immediately the pendularis exercise for 5 minutes, for 5 times a day during 5 minutes each session. The physiotherapy is started after 2 weeks with the physiotherapist, and I want to underline the importance to recover almost all the range of motion before starting all the strength protocols. And finally, something to be careful for you is detecting an individual loss of force, especially in abduction, or an individual loss of sensitivity in the shoulder, because we try to detect the eventually lesion of the axillary nerve caused by the fracture. Because I wanted to remember you that we are with our patient all the day, more times a day, so we can consider each other like the whistleblowers for the medical team. Second, when a fracture is impossible to reduce or we have a problem, a risk for the humeral head, as you know, the option is the hemiarthroplasty of the humeral head. So for immobilization after the surgery, we put our patient in the neutral rotation orthosis for more or less 3-4 weeks. During your nursery case, as before, you can ask to your patient to sustain his arm to help you when you leave the orthosis. But the assisted active movement are not permitted before 1 month and ask. So you can't ask him to help you. And especially we are in a protected surgery, so we have to be careful to the subscapularis to protect him. So don't do the external rotation in a passive and active way, internal rotation in the active way, and especially the internal rotation with the arm on the back before more or less 2 months. For the rehabilitation, we propose the pendularis exercise as before, and the physiotherapy with the physiotherapist is started after 1 month and a half. So I want to underline the importance of recentrating the humeral head in a passive way before starting the active exercise. So after 2 months, we encourage the patient to make the swimming pool, the hydrotherapy. In this case, you have to be careful to good explain to your patient that to be patient during his rehabilitation, to not make any rehabilitation too aggressive, and also you are a whistleblower for some unusual pain or problem, because the risk of the osteolysis of the prosthetic implant and the infection after the surgery are always present. It's a similar situation after the PTA surgery, but in this case, the immobilization is during 3-4 weeks. And do you have for your nursery cares to be really careful to read the report in a clear way, to detect some other intervention on the tendon tissue during the surgery. Because when you have a suture of the rotator cuff or a biceps tenodesis or tenotomy, you can't ask to your patient to make active movement. So when you leave the orthosis, it's you that you have sustained the shoulder before more or less 1 month, 1 month and a half. In the same as before, we have to protect the subscapularis with the no rotation. For the protocol rehab, in this case as well, we propose the pendularis exercise, and the rehabilitation is after 1 month. But I want to underline in this case that almost 70% of the movement in a passive way has to be recovered before giving, for example, self-management exercise at home. Because in this case, the risk is to squeeze the new operated rotator cuff and create more inflammation. So even you, when you make your nursery cares, be careful in the movement of the abduction. And finally, in the case of loss of the competence of the rotator cuff, we have the indication for the reverse shoulder arthroplasty. So the immobilization is in the neuter orthesis for more or less 1 month, and in particular to protect the tuberosity reparation if it is present. Or in this case, it's important for you to read very well the report if it is present a muscular tendon transfer. As before, in this case, you can't ask to your patient to make an active sustain of the shoulder. I propose, in the same time, for example, to put the patient in the pendularis position, to open the shoulder in a passive way, a little bit more. And in this case, you can help, and the patient can help you with the nursery cares. But, for example, is the only case in the protocol rehab we don't recommend the pendularis exercise, because the reverse concept creates a reduction of the mechanical coaptation of the tensile tissue. And the risk in this case of the post-surgery is the luxation of the prosthesis. So the rehabilitation is started after 1 month, 1 month and a half, with the specificity of the work in the deltoid muscle that is the responsible after for the movement of the prosthesis. And finally, I can give you a final advice. So the immobilization permits the movement, but how it depends from the surgery. Read well the report, because you have seen you can be in front of the same immobilization, the same orthosis, but before there was a different surgery and a different indication and contraindication. And finally, we are the whistleblowers for the medical team. So think about this important role you can play in the recovery of the patient. Thank you so much.